In this segment, we're going to show you how to tape an elbow. Now, when the elbow misaligns, it tends to move laterally. This bone here tends to move laterally in the elbow fossa here. When it does that, it tends to rub on this aspect as part of the fossa. This causes irritation and pain around this part of the elbow. That will happen 85% of the time. About 15% of the time, the ulna will move medially towards the inside of the elbow, and it will rub on the inside of the fossa. So our taping is going to be a process of correcting the misaligned ulna here. And that's either going to pull the ulna this way or pull the ulna this way. The most common way, obviously, is to correct for the lateral misalignment. So we're going to teach you that first. We use a tape called Leukotape. We use Leukotape because it sticks well and it lasts for days and days. We like to leave these joints taped sometimes for several days, even 2 or 3 weeks at a time, with a few days break from here and there. And Leukotape is the tape that you can leave on for several days without irritation to the skin. So I only recommend Leukotape. I never use white Johnson & Johnson adhesive tape or anything like it. Only the Leukotape. And the ulna tends to misalign laterally this way. So to correct that, we're going to set the tape on an angle like this. And once we get it there, we're going to pull that tape around and pull it and then anchor it down here and cut. And we're going to do 2 pieces that way. She's got some wrinkles in her skin there, but the tape will stretch and those will disappear after a few hours. Pull again and anchor. Now that's for a lateral ulna. Every time she bends her arm, the tape will pull that bone back into position. And this is the most effective taping, the simplest and most effective method of taping the elbow. We have found nothing or any other manner of taping that will equal this in effectiveness. And it only uses 2 small strips of tape. Remember, the trick is to set it here and give it a pull, because you've got to have the pull.